Welcome to my presentation, Visualizing the Impact of COVID-19 by Selamawit. The agenda is introduction, objective, study objective, problem description, analysis, insights and takeaway, and then we have some conclusion. So as introduction, this project aims to analyze the impact and trends of COVID-19 at the global, national and state levels. The analysis will be conducted using Python, and then we leverage libraries such as Pandas, Bokeh, Matplotlib, and then Seaboard. We will apply discrete statistics to summarize the data, and then we will use some query visualization to illustrate trends in some metrics like confirmed case, days, active cases, and then recovery cases. The study objective is analyzing and exploring the distribution of COVID-19 case across different continents, countries, and then states, focusing on the relationship between new case, active case, and recoveries and then deaths, aiming to identify trends and patterns in the reduction of new cases, active cases, and also deaths. We have problem description. The pandemic progression and impact may vary significantly across continent, region, and states. The variation in case number, active cases, recovery rates, and the mortality rate or death rate has an underlying factor for policymaker and then also healthcare infrastructure. So a comprehensive analysis using granular data, including continent, region, and then state level breakdowns, will help the health organization and the policymaker to do effective resource allocation or anticipate future outbreaks. So for the data analysis, we have the data source. We are using COVID-19 dataset for our analysis, and then the data source is Kaggle. So we got from the website, from the Kaggle website, and then for analysis we will use Python, as I mentioned, in Jupyter Notebook script, and then we will use some libraries like Pandas, Bokeh, Matplotlib, and then Seaborn in Python. So we have to import, before we start analyzing our data, we have to import the data to the Python or to the Jupyter script. So we have to import some important libraries or packages in Python. And then after we import our data, we use the pandas to read our data, so we can directly read by using the pd.read csv command, and then locating our data location and then showing our data name. So that, as I said before, the data name is COVID-19 data. So it has 49,068 rows and then 10 columns, like including province, country, latitude, longitude, the dates, each dates, like the data is recorded, confirmed cases, days, recovery rates, and then active cases, and then the WHO region. So the regions or the continent are classified based on the WHO specification. So loading the data, here what we can tell by looking at the data frame, the file provides 4-day-wise count for COVID-19 download. So the metrics reported are province or state, country or region, latitude, longitude, date, confirmed cases, days, recovered, active cases, and then WHO regions. So the data is provided for 188 days from January 22, 2020 to July 27, 2020. So you have to keep in mind that these are officially reported numbers, and then the actual number of cases and days may be higher or lower, as not, maybe higher as not all cases are diagnosed or reported. So data cleaning. So for every data analysis, before we do any data analysis, we have to do data cleaning. So before performing any data analysis, we need to clean the data. This includes checking data types, handling missing values, and then resolving inconsistency and identifying some outliers. If there is some data like out of the range, like very small in amount or very far from the given range of data, then we call this data outlier or sometimes inconsistency. So we need to rename the column names for easy access to the column. For example, we have province hash state, so we have to change this to state, and then we have country or region, we have to set that country, and then WHO region, of course with WHO region but with a hyphen inside. So we just changed the column name. You can easily see by using this code in Python, so we can easily change to the name of the column, and so it will be easy for us to access the column names. So we can also view some basic information about the data frame using the .info method. So see, state, country as object, data types, and latitude, longitude has the float because the data is float, and date, you see here it has object, but and then confirmed dates recovered active and has integer, and the WHO region has object as well. But you see the date column, it should not be object because Panda doesn't know what this column is, whether this column is a date, because it says object. So we can convert it into a date time using the pd dot to date time method. We have to convert this in pandas. We have to convert the date into date time format, because we see in the information it shows the data type for the date is object, but it should not be object. So we need to convert it to the date time format. And then in line with this, the data has 49,068 rows. However, the state column has only shows 14,664 rows, which means there are a lot of NA values. So we will see in our analysis. So now we can see the data, the date column data type is changed from object to date type, and then there are no outliers as we see in our data, and also inconsistencies. Now we can clean the data, so therefore the data is ready for further analysis. So it appears that each column contains values of a specific data type. So for the numeric column, you can view some statistical information like mean, standard deviation, minimum or maximum value, and number of non-empty values using the .describe method. So this is for latitude, longitude, confirmed days, the days, confirmed cases, and recovery. And for active cases, we can see the count, minimum 95%, 50%, 25% quartile, and then the maximum, also the standard deviation. So these are the given descriptive statistics, and I will ask myself some questions and then try to answer those questions on the analysis using the Python. So for example, the first question says, did certain continent experience more severe outbreaks than others? So what's the analysis method? We use aggregate total case, days, and then active case by WHO region. So we aggregate by the WHO region, the data by the WHO region, and then see if there is more severe outbreak than others among the continent or among the WHO region. So we use this group by, we group by the confirmed date and active case by the WHO region, and then as you see here, there is confirmed case, active, and also days, and then we have listed some countries like 6 countries: Africa, America, North country region, Americas, Eastern Mediterranean, Europe, Southeast Asia, and then the Western Pacific. So it's easier to show you by using the bar plots. This is a bar plot we created. So you see the blue shows confirmed, orange shows days, and then the green shows active cases. So as you see easily in the bar graph, Americas has a great or large number of confirmed cases among the rest continent, even by the days, and then the same active case in active cases, America shows great or the it takes a great place, or it shows large number of um, confirmed case days in the active cases among the other regions. So the outbreak is highly shown, or the pandemic is highly shown its impact in America region compared with the other region. And then if we see this pie chart, the proportion of total case by continent, for example, this is total case. So America takes almost 50% of the total confirmed cases among the other regions. And you see Africa is the least, and Western Pacific is the second least. And then this is the proportion of days by continent. Again, America takes the highest part, almost 50%, almost close to 50% of days is covered by the America continent. And Africa shows 1%, almost there is no days, or 1% is very, very small if you compare with the other regions. And then West Pacific is the second least in days proportion, like compared with other region. Again, how did the number of new cases evolve over time across continents? So if you see the number of new cases evolving across continent over time, so we can easily see this is the analysis, and then by using this or we see we can give this times we can get this time series plot. This is a time series plot we can easily see. So as clearly shown in the time series plot, in America region, number of confirmed cases remain relatively constant from January through the end of March 2020, and in April the cases begin to rise more rapidly, reaching a peak by the end of July. So similarly, in other regions, the number of confirmed cases remain stable during the first quarter and then begin increasing in April, same like the America region. So which region showed the most effective continent, which is low active cases and then high recovery cases? We call it containment. So his analysis we see, so we categorize the data or group the data by WHO region, and then we take the active and then recovery record from the data, and then we divide the recovered by the number of active within the same region, and then plus 1, of course, to protect the zero division. And then you see using this code we will see this graph. Actually we can easily see the result here, and that's shown by the effective score. In the output, the Western Pacific region demonstrates the most effective containment, followed by the Eastern Mediterranean. The effective containment means the highest or efficiency score. If we see the highest efficiency score, then we call it the effective containment. So the America exhibits the poorest containment performance. How does the recovery rate compare to the days rate across different continents? How does recovery rate compare to the days rate? So we see this output, we see the recovered by confirmed cases, this is the recovery rate, and then the days rate, again, days rate divided by the confirmed cases, we will get the days rate. So we compare with the days rate with the recovery rate. So West Pacific has highest recovery rate, and America and again Europe has the lowest recovery rate. America has the highest death rate, but however it has the lowest recovery rate. So you can also see both recovery rate and death rate by this bar graph plot. So the Western Pacific region has the lowest death rate and then higher recovery rate, followed by Southeast Asia, and then Africa in the third place. So in contrast, America recorded the highest death rate and the lower recovery rates. Top countries with confirmed cases in the American region. So when we see in our all previous analysis, the America region shows the highest death rates, highest active case, and then highest confirmed cases. So we need to see which country is contributing the most cases, COVID cases or pandemic cases for America. So we use the following code to show this graph, and then according to this bar graph, the US among the American region, the US shows the highest confirmed cases. So in our analysis above, America region had the highest number of confirmed cases, and then latest within this region, the United States had the highest number of confirmed cases, and then the Dominican Republic has the least number of confirmed cases. So at the last, which country had the highest death rate relative to active cases in America? We have seen that US has the greatest confirmed cases, or the large confirmed cases, and then the Dominican Republic has small number of cases among the America region. So now we need to know which country had the highest death rate in America. As shown in this table, the Mexico has the highest death rate relative to active case. It's relative to active case based on the number of cases, active cases we have. So what's the death rate to the active cases? So it shows Mexico has the greatest or the highest death rate. Surprisingly, although the United States has the highest number of confirmed cases, its death rate relative to active case is lower compared to other countries in the Americas. When we see the number of confirmed cases, the United States has the highest confirmed cases. But when we come to the death rates, according to its active cases, Mexico has the greatest, the highest death rate. So therefore, it is important to examine the death rate across region. That's why we see the death rate across region. So which state had the fastest recovery rate over time? Okay, so we see this progression, track recovery rate progression per state. And this is a time series plot for the top 5 countries, which shows the fastest recovery rate. The top 5 countries. So Grenada, Dominic, Cuba, Chile, and St. Lucia. As we easily see in the given plot, the St. Lucia shows the fastest recovery rate. So, and then we can also see the final recovery rate. This is the final recovery rate, and then Grenada, it comes to the top. Now St. Lucia comes to the 5th. This is the final recovery rate progression per state. Based on the recovery rate and then the final recovery rate ranking table, St. Lucia has the highest recovery rate among the countries in the Americas. However, according to the final recovery rates ranking, Grenada ranks highest with a score of 0.958, while St. Lucia is in the 5th place. Okay, we have final insights and takeaway. America is the highest in confirmed cases, active cases, and then deaths. And Western Pacific has the highest efficiency score and effective containment among the WHO region. The US is the top country in the number of confirmed cases, and then Mexico has the highest death rate. St. Lucia has the highest recovery rate. The America region is leading globally in both confirmed cases and then death rates. Within this region, the United States, stands out with the highest number of confirmed cases, reflecting its large population and extensive testing. Mexico records the highest death rate, pointing to critical healthcare strain and possibly underreported active cases or delayed recoveries. In contrast, St. Lucia demonstrates remarkable resilience with the highest recovery rate, suggesting effective treatment protocol and containment strategies. Meanwhile, the Western Pacific region emerges as a global benchmark for containment, achieving the highest efficiency score, a testament in public health measure, early intervention in strong communication. As a conclusion, we analyzed COVID-19 data from Kaggle using Python with pandas, Spokane, Matplotlib, and Seaborn libraries. The dataset includes 49,068 rows and then 10 columns, including geographic coordinates. Based on 2020 data, the America region reported the highest number of confirmed cases, deaths, and active cases. In contrast, the Western Pacific and then Africa region showed significantly lower figures in these categories in relatively high recovery rates. Death rates were notably high in the America and Europe. Our calculated efficiency score based on containment and recovery metrics suggests the Western Pacific region demonstrated the most effective responses, followed by the Eastern Mediterranean, while the Americas lagged behind. Within the America, the United States had the highest confirmed cases, confirmed cases following Brazil. Smaller nations like Dominic and St. Lucia showed highest recovery, while Mexico had a notably high death rates. Thank you for your attention. This is Selamawit.